Hi, everyone. I'm so honored to have Dr. Rachel Rubin on with us today. She is a trailblazer. Not only is she an incredible advocate for patient care and just improving the quality of patient care for chronic pelvic pain, but she spends a lot of time educating other physicians and having that equal playing field, for everyone, no matter what location they're in. So she is an expert in vestibulodynia and vestibulectomy surgeries, but there's so much more to your practice too. So if you wouldn't mind, Dr. Rubin, just sharing a bit more about why people would benefit to come to you.
Well, I am so glad to be here, and we at my practice, we're all big fans of Kelsey Bates. You come up quite
Thank you.
often, and it truly. So I'm a urologist. I have a practice in the Washington D.C. area, and we have a wing in Los Angeles. I did fellowship training in sexual medicine, and so we take care of everybody, and we do things like libido, arousal, orgasm, and pain. And when we take care of everybody, we really try to do so in what we call a biopsychosocial lens, which means we really often need multidisciplinary care in order to help meet people where they are and give them what they need. Because when it comes to quality of life, everybody's story is different and what everybody needs is different. And if we don't know what people need and want, we can't really help get them there. And so we can't do our jobs without incredible people like you, our mental health professionals, and we can't do our jobs without other clinicians like pelvic floor physical therapists and lots of people in this space. So it's always fun to have these multidisciplinary conversations because I have so much to learn and we have so many things we need to do to help give better care to our patients.
I completely agree. It's like I find such relief knowing that my clients have this team behind them of I can't help you move in the right way and I can't help, with the medical prescription side of things, right? Like it's just and surgical for like there's just such a need for everyone to be involved. And I think conditions, especially like chronic pelvic pain, can be so isolating and hard to talk about, a lot of stigma and lack of understanding. How do you see this impacting the mental health of your patients?
So there's no question, right? So if you have pain, if you have chronic illness, if you feel alone and it is affecting your sexual health and your quality of life, how can that not affect your mental health? So I always tell my patients, this is not in your head. You're not making any of this up, but what it does to mess up with your head is very significant. How could it not? And I also love to remind patients about biology in that their head is a very large part of their body. In fact, it is the main computer mainframe of their, the main hard drive of their whole body. And so when they understand the biology, the physiology, and how it all works, I think it takes such a relief off of, oh, is this all in my head? Am I making this up? And so mental health is a huge component of what we do. And it's funny, I often get thought of, many people think I'm a therapist, which drives me crazy, but because I actually talk to people, they assume I'm a therapist. And I joke that I'm a psychourologist. But the reality is when you spend time with people and you get to know them, that is medicine, right? That is therapeutic. That just listening and validating and hearing their stories and taking on part of their story and listening to it and trying to, I would say I'm kind of like a sex detective. Like I'm trying to take their story and make it make sense in what we think is going on with them, is medicine. It's part of the journey. And so when we work with other clinicians that help, in these, that's how I see people get better is that they have a team that supports them and that they feel is helping to take care of them. And also that they are empowered to be in control of their team and to feel like they can add and subtract and honestly manage their team. And that is how we really see improvement in people's lives.
Absolutely. And I hear, from your practice, particularly yourself, Dr. Kloss, Dr. Vaccaro, like sometimes this is the first time a patient walks away, say they heard me, they took their time, and just the mental health benefits of that alone is so it reduces that medical trauma. It helps them have hope again that a team can take care of them. So I know firsthand you guys have such a trauma informed lens.
And I think that's a really amazing point, right? Like you hear what happens when they leave. We don't always hear that, but I think to your point is if people can leave our office with hope, and that is usually they can understand that we don't have a magic wand or a light switch that immediately, we can't snap our fingers and make them better. But if you leave our office feeling that there is a game plan and an idea and all of that, I mean, that is the blessing, right? Of how we can really try to help people. And I always say, I joke, it's not really a joke, it's serious, but our medical visits are so long because we have to make up for all of the trauma that has happened before us. We have to literally take it on and hear about all the awful doctor's visits, all the nasty things that were said, all the gaslighting, all of these things. And it is pervasive. It is whether you are the richest person in town, or you struggle to make ends meet. Like this is happening to everyone, even myself included. I've experienced it too, and we really hold space for that.
And that becomes, I think, a challenge for you, right? As a provider, like that's heavy to carry too. So I mean, I think you see the need for even more education. Maybe that's part of what drives you to do so much advocacy and education with doctors too. I mean, it's, you are benefiting that patient in the moment, but you're also healing a lot of past hurts too, which can't be overstated enough. And I agree that I think it takes a team to find stability with a chronic condition, and that's when I also see the improvements. Right, we need everyone. I'm wondering if it's hard sometimes to broach the topic of including mental health care with your patients, or what that looks like.
Actually have a good example of somebody I saw just this week. It was kind of, so someone came to see me. They drove hours and hours and hours to come to see me. They have had pain with intercourse for years. And they also have had a very rare medical condition where they have felt constant sort of arousal that was unwanted since they were a little kid. And they came to see me for after hours of travel, and they have never talked with their partner about these issues. They have never spoken about it. They've never spoken to anybody about these issues. And it was so therapeutic to have this conversation and to talk. And when I asked about, oh my gosh, you've been holding on to this for so long and how terrible that must be, I said, have you ever thought about, talking with somebody and seeing a therapist? And she said, no, no, no. Like that's great for other people, but like there are many reasons why I don't think it's the right fit for me. And again, that's just a question, and we keep going with our questions. And when we get through to it again, and this is not a right or wrong way to do it, but the conversation sort of kept evolving, and we talked about all the medical issues, the biology, what we're going to do, how we're going to help her. And I truly have a good plan to help her. And I'm hopeful, I'm really hopeful about her care. But I really leveled with her, and I said, listen, I said, I was at a cocktail party once, and this really fancy concierge primary care doctor and I were chit-chatting about our own traumas. And she said to me, man, Rachel, like I'm with you. She says, you know what? I know Ann Smith in our area is like an amazing therapist. And I know you, like you should go see Ann. And I made an appointment, and the lady had me figured out in an hour flat. She was way smarter than I am by a million times over, and she is my guardian angel and changed my life. And I share that story of like, I had a good fit, right? Someone was able to figure me out and was able to call me on all my bullshit, excuse my language, but she was able every time. My favorite thing she says is, Rachel, like the data does not support your thoughts, right? Like let's go through that. The data does not support your thoughts. And I was able to find someone who was able to hear me, see me, meet me where I was, and then really like call me on my stuff. And I told the patient that story, and I sort of talked her through it. And you saw some light bulbs open up in her mind of like, wow, I have seen many doctors before, and nobody's talked to me the way that you are talking to me today. So maybe that there is a mental health person out there who might be the right fit for me. But the reality is knowing that someone's giving you a name and giving you someone saying, actually, you should see this person is going to make a big difference. And so for me, it's actually very important that I give people names as opposed to lists. And sometimes you do get, like, if I say, hey, you live in this part of town, this Jen is the physical therapist you need to see because I have her cell phone number and I know you're going to vibe well together. And this is why me knowing people, relationships really matter. And so I know that was a long-winded way of, like, for me, it's meeting people where they are and then helping to push them gently into realizing that the data does not support their thoughts, and also, like, maybe they just need someone sort of helping to, like, fight with them, kind of a thing.
Yeah. And how amazing that you could be vulnerable in that moment to share what a proactive and positive experience therapy was for you. That already knocks down a lot of stigma of, if this provider I really respect and trust is sharing this, well, yeah, maybe I'll take that into consideration and I can challenge that thought too. And I think bottom line also is yourself, your colleagues, you never stigmatize the mental health piece because you value, how much, no, this is not in your head, this is really happening, and you deserve support. Keeping this all inside just because it's hard to talk about or stigmatize, you deserve to have that space, you deserve to have support.
One of the things I talk to patients a lot about is sort of this idea of words matter. I think the term therapy has this really, like, you're broken connotation to it, as opposed to I present it as, like, listen, Serena Williams has like 5 tennis coaches and she is not bad at tennis. She is very good at tennis. And so, like, this idea of, like, you deserve a pit crew to help you and see you and optimize you. And I think my favorite analogy, and I cannot take credit for this analogy, but I learned it from this incredible doctor named Alyssa Zingman, who has pioneered the field of sort of Ehlers-Danlos connective tissue disorders and sort of dealing with these zebras, they call them. And she has given me these analogies that I have taken and I've run with. But this idea of, like, hey, if you have a chronic medical condition, like, you're not broken, you're like a Lamborghini, right? Like, you can't go to the Honda dealership because you need the fancy parts. Like, people pay gajillions of dollars for you, and you then have to keep up the maintenance of a gajillion-dollar vehicle. And it stinks because you didn't choose to be a Lamborghini, but, like, unfortunately the Lamborghini chose you, and now you have to maintain the Lamborghini. And so it just paints the picture of, like, yeah, it costs more money, it takes more effort, it takes more time, you got to read about it, and the regular Honda dealer down the street cannot manage you and can't take care of you. And so you can kick and scream all you want, but, like, the reality is you're stuck with the Lamborghini, and, like, you need to be proud and, like, get all the outfits to go with it and, like, lean into the Lamborghini life. And so I just love that. And then it goes even farther in this idea of a pit crew model of, like, if you're managing a fancy sports car, you've got to have the tire guy and you've got to have the gas guy and you've got to have the person who deals with the exterior. Like, you cannot have one person that does all the things. And I just find that analogy so deeply powerful because patients can see that. And again, it makes them feel less broken and it makes them feel supported and almost empowered to kind of be the other example she's given me, which I just love her, but, like, is to be the CEO of your life, right? Like, you are the CEO. And so you're bringing in your chief medical officer, your chief financial officer, you're bringing in these people. And as soon as they are not serving you, they're out. You can, like, if you have a therapist that you're not vibing with, goodbye. If you have a doctor that is gaslighting you, goodbye. Like, this is where you have to be empowered to say, you know what? There are no grownups coming to save the day. I am the grown-up and I am going to bring people in my life. And if they fill my cup and they are helping me get to where I'm going, fabulous. And as soon as they stop serving me, goodbye.
I love that. I think that's a wonderful example also of radical acceptance of, I'm going to radically accept I didn't choose to be the Lamborghini, but I'm going to make a pit crew. And you do have control. You can say this person has helped me get this far, but right now, they've kind of done their role and I need to replace their role. Like, you do have power and autonomy there too. So anyone who has you in their pit crew is just so incredibly lucky. And I'm incredibly lucky to know you and your practice. Thank you so much, Rachel, for taking the time to speak with me today.
Thank you for having me.
Thank you.